Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an audiologist talking to a patient who's trying hearing aid.
Good morning. How are you feeling with the hearing aid so far?
They're okay, I guess. I can hear better, but everything sounds a bit too loud, and some sounds are kind of tinny.
That's common when you first start wearing hearing aids. Your brain needs some time to adjust to the new sounds. We can fine-tune the settings to make them more comfortable.
I'm worried about whether I'll be able to adjust them on my own if I need to. It's a bit overwhelming.
I understand. Let's go over the controls together so you feel more confident. We can also set up a follow-up appointment to check in on how you're doing.
That would be helpful. I also noticed some feedback when I put them in earlier, like a high-pitched whistling sound.
That can happen if the fit isn't quite right or if there's something blocking the microphone. We'll check the fit and make any necessary adjustments.
Now look at question 26. You hear Nurse Alex asking Dr. Patel for help with a patient who received a COVID-19 vaccine. Now read the question.
Dr. Patel, could you help me with the patient in room 205? The gentleman who received his COVID-19 vaccine yesterday.
Ah, yes. He's due for discharge today, isn't he? How's he feeling?
Physically, he's doing well, but he's quite anxious about potential side effects. He's worried about the fever and muscle aches he might experience.
Understandable. Let's go see him together. Reassurance is essential after vaccination. Has he been informed about the common post-vaccine symptoms?
Yes, I explained it to him, but he's still concerned. Perhaps you could provide additional reassurance?
Of course. We'll address his worries and ensure he's well informed. And let's check his analgesia while we're at it.
Now look at question 27. You hear a senior nurse discussing a new patient education program on her ward. Now read the question.
We've recently implemented a new patient education program to enhance patients' understanding of their conditions and treatment plans. We've created interactive workshops that cover topics like medication management, symptom recognition, and self-care techniques. The workshops are conducted by a team of nurses and healthcare providers who use engaging materials and real-life examples to make the information accessible and relevant. We've noticed a significant improvement in patients' confidence and ability to manage their health since the program started. Additionally, we've incorporated feedback from participants to continuously refine the content and delivery of the workshops. This ongoing improvement process ensures that the education provided remains up-to-date and tailored to patients' needs. The positive outcomes from this initiative have encouraged us to consider similar programs for other aspects of patient care, further promoting proactive health management and improving overall patient satisfaction.
Now look at question 28. You hear two doctors discussing the diagnostic tests for a patient with chest pain. Now read the question.
I just got a call from the ER. They have a 70-year-old patient with chest pain. They suspect a heart attack and want to order a cardiac CT.
That's a good call, but given the patient's age, we should consider an ECG first. It's faster and can rule out a heart attack in many cases.
Agreed. If the ECG is inconclusive, then we can proceed with the CT. But let's prioritize the ECG to minimize radiation exposure. It's important to be cautious with older patients, especially when considering tests that involve radiation.
Good plan. What if the ECG shows a heart attack?
Then we'll need to proceed with a cardiac catheterization to confirm the diagnosis and potentially open the blocked artery. We should also prepare the patient and family for the possibility of an immediate intervention.
Okay, let's call the ER back with our plan.
Now look at question 29. You hear part of a surgical team's briefing. Now read the question.
All right, let's discuss Mr. Gupta's case. He's scheduled for a coronary artery bypass graft. Any concerns about his medical history?
He has a history of chronic obstructive pulmonary disease, COPD. His lung function is stable, but we might need to adjust the ventilation settings. We should also be cautious with anesthesia, as patients with COPD can be more sensitive.
Will we need any special equipment due to his COPD?
No, we should be able to manage with standard equipment. However, we might need to monitor his oxygen saturation more closely, especially during induction and emergence. Close monitoring will help us respond quickly to any respiratory issues that may arise.
And what about his medications? Should we adjust any of them preoperatively?
We'll need to consult with his pulmonologist to determine if any adjustments are necessary.
Now look at question 30. You hear a researcher discussing a study on telemedicine in rural healthcare. Now read the question. We are conducting a study on the effectiveness of telemedicine in rural healthcare settings. The goal is to assess how telemedicine can improve access to care, reduce wait times, and enhance patient outcomes in areas with limited healthcare resources. We are looking at a variety of factors, including patient satisfaction, adherence to treatment plans, and overall health outcomes. While there's growing evidence supporting the benefits of telemedicine, more research is needed to understand its long-term impact and identify the best practices for implementation. In addition, we aim to explore the challenges faced by healthcare providers in these settings, such as technology barriers and training requirements. Understanding these challenges will help us develop strategies to overcome them, ensuring that telemedicine is both effective and sustainable. We hope that the findings from this study will contribute valuable insights into how telemedicine can be integrated into rural healthcare systems, ultimately improving the quality of care for underserved populations.